Thank you very much. It's a pleasure having you. My name, once again, is Ibasi Patricia Tops. I work for the radio community. It's a pleasure to have you. Maybe introduce yourself.
Thank you very much. I'm Lole Laile Lole, the Executive Director of South Sudan Network of People Living with HIV. Glad to have this interview. Thank you very much.
Yeah, my name is Lole Alice Lole. I'm the Program Officer for SNAP. Welcome.
Thank you very much, Lole and Alice. Yeah, maybe we just go straight to the thing. We know that Trump's administration had a move to stop the supply of life-saving drugs for HIV, malaria and TB, as well as medical supplies for new babies in the country, supported by USAID around the globe. And maybe looking at South Sudan network of people living with HIV, how maybe you can explain the impact of this Trump administration to halt this supply of life-saving drugs.
Okay, thank you very much. Actually, drug supply are not procured by paper or CDC or by the President's Emergency Fund. The drugs are supplied by the Global Fund, but the activities are the fund that they give us fund to carry out activities of outreach programs, refill, and then out in facility staff who are going to work for providing salaries for all these people to work and carry out the activities of HIV services in the country. So the impact of stopping of this grant means all the people who have been carrying out these activities are now laid off or they stop because they are not going to work, which means the people living there will not have any other services like follow-up, facility staff who are going to work in the facilities. The facilities now left vacant without employees. This is where there's a big problem with the emergency fund being stopped. And the way it got stopped is also a very serious drop without any transitional system organized. We were surprised with a letter on the 28th of January that everything is stopped. They stopped all the staff, must go only a letter and that day. So we are shocked on that procedure. Rather than informing us like that by next year or by next month or by next we will be stopping this. But we heard something called executive order by the President of the United States that everything come to stand still. And right from that day, we give notice to the staffs to go home because we will not be paid, and then we wait for what next. And then in the letter they indicated 30 days or 90 days on hold. They said on hold, and we wait for the on hold until when? Whether the 90 days something will happen or not happen. We are still at suspend. We don't know what is going to happen because the details are not provided to us. Only we receive the letter and we stop and they say, okay, on hold for almost 90 days and we are still waiting.
Okay, and maybe looking at the South Sudan network for people living with HIV, yeah, you had staff who are getting salary from this support. And then maybe looking at how many staff did you have and how many are affected currently? In
the country is too huge, but in our specific network, we have about 11 or 12 staffs who are working in the facilities in Juba. We have 2 facilities that we are managing directly. We have Kimu and Lutheran that we are managing directly. We have RT and the PMTTC, we have outreach programs, we have people who are carrying out the activities of data clerks to implement the information, generate all the information, because without data, you don't know how many people have been treated, how many people have been given refill, all these are carried out, and then we report to the donor. But now all these were laid off since that day up to today. If I see the 28th up to today, the 11th, which means 15 days now, nobody is in the facilities. And then people living there who have been supposed to be refilled, supposed to be followed up, supposed to be given medicines, and even coming to assess drugs in the facility are no longer there.
So how will this move affect effects to combat the HIV epidemic, especially globally or even in South Sudan here?
It's globally, but South Sudan is not in isolation. That means all the global are affected with the same order. And even the embassy officer, people are already go home in the embassy. And then it is global anyway, done by Trump. Trump may be working with his decisions that he want to change. Because I read the letter I was telling what he wanted to align or evaluate and align the activity of to the American policy. To the American policy. That's why we didn't know what policy, because what to America is one.
All right, and maybe Alice, maybe going to you. Do you think with this situation, the current situation, it will lead to an increase of HIV transmission rate due to the lack of access to medication, especially at the health centers?
Yeah, thank you. I think I need to also talk of some of the impact.
Yes.
You know, stigma in South Sudan is still very high. And most of these services which are given under the USAID is dealing with these things to do with the drug refill, the viral load sample collections, and the testing are all done in the community, that people are not exposed to come to the facility and so on. So now stopping this, the impact will come to what you have just said. Increase in the number of people who are going to be infected with HIV. Because now there's no more testing in the community. And you know, people don't come to the facility to do tests. Just like I'm going to test to know my HIV status. So most of these people are found in the community, and then they are linked to the facilities. That is how the impact of this USAID project is for the country. That's why we have enrolled so many people on the treatment because of the community package. We also understand that the USAID was doing a very great work for the HIV program. You look at some of the one-stop center, which is entangling all the services of the GBV, the survivors who are put into these one-stop centers. And one-stop centers are usually put in the facilities. Even when you go to the States, you find that they are there, and these are all done by USAID, some are done by Global Fund. So this is really a very big impact now to the general population, including the people living with HIV, because any other person who has been raped or who has gone through gender-based violence, whether it being HIV related, is all taken to the one-stop center. So the impact really is very huge. And you see the drug refill, particularly the drug refill, the communities are now that idea of taking their drugs from the facility to the community, wherever they are. And these people are linked to these people who already work in the facility. Because of the stigma, people don't want to be linked to people anyhow. People don't want to be taken to healthcare workers in the facility anyhow. You are linked to only one volunteer, or you are linked to somebody who is working in the area, TSA clinician, that is it. So now, taking away these people, what does it mean? It means that those people will never come for their refills. And there's nobody who is taking for them the refills to their houses, or even going to take their viral load sample collection, because when you go for refill, you also take the viral load sample collection to monitor how this person is taking the medication. Now this is all stopped. This is all stopped, and this is now the great impact. And yes, the Global Fund is also funding the HIV program, TB and malaria, but now the services are given by these people. Though to some extent also there is a small volunteers who are paid under the Global Fund, but it cannot cover the whole counties or the whole states. So that is the impact and the increase. I'm sure after some survey or data collection, we will see the result within this 1 month or 2 weeks, how the increase has gone, whether high or how many people have died because of this, or how many people are even lost to follow-up who have not turned up for their drug refill. With time, maybe within a month we shall see the impact.
And then maybe looking at, are there some solutions that South Sudan network of people living with HIV, are there some solutions that you have put in place to limit the interruption of treatment, or for people who are coming for refill of drugs?
Okay, thank you. You see, to reach us this far, we have been working with these two donors, main ones, which is the CDC, which is the paper, and Global Fund. This was something prepared for quite a long time. That means it goes back to 2007, 2006, where CDC carries a lot of money for the year, over 50 million for a year to meet these activities. And Global Fund maybe 40 only for the drug supply and rest. Then we coordinate together how the activity will go. For us, the network, we're supposed to depend on the government. But what happened in the government was right from the beginning. They have taken the responsibility of health into the partners. So they only provide us with the enabling environment, no specific budget as a fallback. But now we are thinking we need to meet the undersecretary. That's why we put it as a measure, because this thing is a sharp decision. It has not given us a period, just a sharp decision. So we are now doing consultation that we need to see the Minister of Health. And yesterday, Anders also removed. We are going maybe to see the Undersecretary to form our plan. Tell us what next, since this donor, which has been with us for quite a long time, with a common understanding, and then we had made contracted more partners across the country in South Sudan, big international organizations, and then they all subtract many small NGOs or national NGOs, so that to reach the service to the grassroots. Now all these are paralyzed, which means to strategize again, we need to meet because we work in hand with the government, we need to meet with the leadership of the Minister of Health and discuss the modality, how are we going to make the another way to rescue the situation. Otherwise, the things are hard because it is very sad. The news is very coming in a short time. I cannot promise you that we have already had an alternative that can rescue the situation. No, there's no at all, because South Sudanese, you know how the Minister of Health in South Sudan, in the budget, they have not received salary for almost 1 year and a half, and then that budget is not there. That's a challenge to us as people living with HIV. But we will try with the Minister of Health leadership what is the other way forward to save our people.
Okay. Lole, I don't know if you see this as a violation of human rights, and why?
In fact, it is the violation of human rights, because you cannot tamper with health and as well as humanitarian support. The two activities, the health is a human right, and then humanitarian is whether this place is a human right. Now has been violated, whether humanitarian, whether health is already. Suppose when you are sick, you went to the hospital, the first thing after being diagnosed, the first thing for you to say is, oh, any medicine? Automatically there's medicine to say I'm safe. But now if you go to the facility, you get it, no medicine. What do you see? It's already a right that's been violated by the government, because the government is to take the responsibility of its citizens. That's why there must be medicine for your citizens available for the services of your citizens. But now it has been violated. It's a violation of the human right for the people to receive services.
And then now with such scenario, how can people living with HIV prepare for potential medication shortages?
People living there now have no option, but our network will try with the leadership of the Ministry of Health. What will be the way forward? Because the donor, which has been covering all this, has pulled out its money. But we say also, maybe our mistake, because we have been defending too much on the foreign support. And the foreign support sometimes can go. It's like when we have the oil long time will drive without continue with the non-tax revenue. We need to make sure that our government must prepare to take care of its own citizens than leaving the people living in the hands of the external support.
And maybe I'll throw this question to Alice. Maybe what steps should be taken to ensure continued support for vulnerable populations?
Yeah, I I also wanted to add on top of what Mr. Lole has said. For the network of people living with HIV, we have also, you know, the grant, which now is in the country, the USAID or PEPFAR, and then the Global Fund, the way they structure. Otherwise, the network of people living with HIV is in all the 10 states and then some counties. But because of this programming, they said you should not be in this side, you should not be in this facility, and so on. Otherwise, before we used to put these people, all the facilities, there are volunteers who are working there, who are the ones supporting the adherence, the ones supporting issues to do with stigma and discrimination, drug refill. Now we look at Juba. Here in Juba, we don't have any people living with HIV volunteers who are working in the facilities, except the two, the Genesis and the Ibi. The rest of the facilities, they don't want the people living with HIV who are expert clients to be in this facility. So this is now the problem. Because if these people were there, these services, which we have been talking about, more especially the stigma, the drug refill, and so on, would have been flowing. So we are going to have meetings, already discussions going on with UNDP, and then the ministry, we are going to discuss. Now this has happened, what next? Are we allowed to go to those facilities like in Juba, where our people are not there to go and do these voluntary services to help their clients? So this is what plan again we have now. It's a strategy to cope with. The other question you asked.
Yeah, I asked you like what steps should be taken to ensure continued support for vulnerable people.
You see, for the network of people living with HIV, we don't have any other fundraising or any other support. We are only getting the support of the USAID and then the Global Fund. Even for before, we used to get support from WFP for nutritional support and so on, but now all these things are stopped. But we are also now trying to encourage the people living with HIV to be productive themselves, trying to do things for themselves, maybe gathering, and then maybe doing some other economic activities which can bring for them. And that is what we are trying to do, and this is in line with some of the surveys which have been done, and recommendations have been made for us to move forward like that, so that they will continue supporting themselves in their communities. We have communities like in Pajok, they are doing very great, they are doing farming, they have sacks of peanuts. So we're encouraging all of them to come up with something. And we are doing some trainings. We started in Juba for the PLHIV to start doing something different, being trained on how to empower them with some skills and so on. So if we get some support like that for training, we want to do it in all the states and some countries, so that people will start doing, as these supports face off, this is where they can support themselves.
Yeah, let me add there. From the start, we started as volunteers. We were working on voluntary basis, things like that. On voluntary basis, there was no problem. But when the time comes for that, inflation, poverty, and all this has drawn people that you cannot move unless you need support with transport. You need support of ABCD. This was how the problem became difficult. But formally, people can walk freely, they have no problem, they can do their work. But now, the inflation that in the country, the poverty that is created in the country, has made life very difficult for the volunteers to do their work. Because the volunteers used to have food, they have enough food in the house, they can go to the facility, they can eat. But now, if you don't have money in hand, you cannot move from point A to point B. That was why we now insist that there must be incentive that the transport refund can be given to the volunteers so that they will be able to reach the point A and B. Now they have been doing it, and now it's being stopped. Now again, they are transforming. We need now, so one of the methodology we want to put also, we need to transform them back, but transforming them back again, it will be a little challenge there, because they are already used for a number of years. We give it incentive for their traveling, for their movement, for their feed, for all this. Now it is going to get stopped. Is it actually there is a negative, most the impact that is going to happen? We expect a lot of problems to happen in the 3 diseases, malaria, HIV, and TB. It's going to happen because the labor force is now made redundant. It's no longer there.
And then maybe, okay, lastly, maybe what could be your message? I know most people living with HIV are now terrified with such. So what could be your message? And also maybe to the people who have been supporting you people.
Actually, for us, the network, we need to appeal to the other donors to make sure that they also replace those donors that are being removed. And also our government also have to strategize itself. If there's another donor, like the World Bank should come in and take off these people as a transition. Meanwhile, the government is preparing to take care of its own people, because all these people are complementing the work of the government. Any donor is to complement the activity of the government. And the government knows very well that solidly they are responsible about that people, 90%. 10% is allowed to their partners or donors to complement or to bridge the gap. So I think our message is we are appealing to the government and other donors so that we work together and bridge the gap.
Thank you very much.
Yeah.